Good morning, everyone, and welcome back to the next episode of the Back Porch Banters. We are honored today to have Dr. Richard Hudspeth, Duke University graduate, extensive medical care from volunteering in India to CEO of Blue Ridge Health here in Hendersonville, North Carolina, extensive medical experience, extensive leadership background, and he is now running for Congress to fill an obvious and major gap in leadership and experience. Thank you, Richard.
Pleasure to be here. Thank you for having me.
All right. First question I got for you. What in the world prompted you to do this? You are running for office, and like me, you now know how difficult this is. So what's your inspiration? What problem are you solving? What are you after?
Great question. So I'm a physician. I'm a family doctor, and I've been serving patients in Henderson County, as you said, for over 20 years now. And I've also been the CEO at Western North Carolina's largest community health center. I've spent my entire career advocating for compassionate and affordable health care for everyone, because I believe no matter their income, everyone deserves access to affordable health care.
Yeah, I agree. I mean, we're one of the richest nations in the world. We can afford to take care of our people.
Absolutely. And then in the past 10 years as CEO of, again, Western North Carolina's largest community health center, we were able to take this model and create exactly what our mission was to do, and that is to create access. We were able to more than triple the number of patients who had access to care, quadruple the number of providers and clinics, as well as quadruple our workforce that's out there taking care of our
How'd you pull that off?
I think a lot of it's just getting the right people, getting them connected into a mission of service. And my life into medicine was really begun at service, right? So you mentioned in the intro about my time in India. So I served at Mother Teresa's home in Calcutta, India. And there I met a man, and he was not much older than myself at the time. And he died. He died needlessly from tuberculosis because of his poverty and lack to basic health care. Before he died, he'd asked me to shave his head, which I thought was strange, but I did it. Right? But it turned out, what I learned later was that was really an act of symbolism of purification as he left this life and moved to the next. And really what I understood is he just wanted just a moment, a little bit of dignity at the end of his life that had given him so little.
Yeah.
For me, what I see now in our world is that we are seeing more and more people being left out and left behind. That's unacceptable to me.
Yeah.
We need to do better, and that's why I'm running for Congress in NC11.
Awesome. So give me some specifics, as much as you can, as much as you want to, about what exactly you would change about our healthcare system, how we pay, how we do it. You know, I am also a medical provider. I see a lot of inefficiencies in the system. I also see, as you mentioned, a lack of kindness, a lack of general access. And to me, they're two separate and overlapping issues. So dive as deep as you want. We can get as geeky as you want to here, because I'm really curious about what specifically you would do to change this system and improve access.
So there's a lot that needs to be changed, right? Let's just start with, if you would, some basic information, right? As you said at the beginning, we're the wealthiest nation on earth, and we spend the most in healthcare than any other nation on earth. When you look at comparable developed wealthy nations similar to the United States, we spend more than twice the amount of money that they do.
That's insane.
And you know this.
And their outcomes are just as good as ours, and sometimes better.
We have worse outcomes. If you look at a simple outcome like how long do people live in each of these countries, we're 48th on that list.
Oh, good grief.
But we spend the most amount of dollars. So for us to solve this healthcare crisis problem, it's not about spending more money. It's about rethinking and reallocating how we spend money.
Yeah.
Clearly, my platform, we need to strengthen and keep Medicare and Medicaid. What we see is the likely destruction of Medicaid expansion in that state. That's going to hurt our rural areas even more. You know, 650,000 people in just a year and a half qualified for Medicaid expansion. And in our rural areas, that's going to be really hard hit if they lose that, and it's going to be problematic for our rural areas.
Yeah, I remember looking at the Blue Ridge Hospital that it may close because that Medicare money is a large part of what they get. It's a low-income area. Running a hospital is expensive, and it's 45 minutes to the next closest hospital. Yeah, that's a big deal. And they're looking at likely closure if the Medicaid cuts don't get reversed.
They're not probably the only hospital.
No,
right?
I think there's 7 that are in danger.
Because the payer mix, that is, what does it look like for people in Western North Carolina? Probably 70% or so of hospitals are getting Medicare and Medicaid, and some of it commercial insurance after that.
Yeah.
And when we're seeing cuts and cuts, so the state instituted cuts across the board just in October 1st around Medicaid. So this is before even the Medicaid cuts come from the federal government. 3, 8, and 10%.
Right. We've got multiple layers of problems here.
We do.
I mean, we've got a gerrymandered North Carolina under solid Republican control that's been pulling money out of healthcare and education for the last dozen years.
Right. Well, they gerrymandered, and I know that this district is now probably the most vulnerable and flippable district in North Carolina.
I think they made a mistake gerrymandering this one. I think we can get them. Right.
So I think if congressional seat District 1 can hold on to their seat, and we can flip this one, we can gain, maybe just hold steady, but it's super important. And as I said, I'm a family doc, and so healthcare is super important. Roy Cooper, when he announced his run for Senate, he said, my number one issue is going to be healthcare, right? And certainly lining up with Roy Cooper there at the top of the ticket. Let me tell you, you asked me, what are some of the proposals that I have?
Yeah.
Well, before the camera started rolling, we were talking.
Yeah.
You were primary care. You're a practitioner as well.
Yeah.
When we look at, to me, what has been shown throughout the medical literature as to what actually works in medicine, it's primary care. If we want to improve outcomes and lower costs, we need to invest in primary care more than what we do. Right now, there's a term, it's called primary care spend. How much of the whole healthcare dollars do we spend on just this aspect of primary care?
Right.
It's important how you define it, all of those things.
Yeah.
But in general, when you look at that, the United States now is less than 5% of their primary care spend.
Because we're spending gazillions of dollars on all these heroic efforts to fix the failures in primary care.
There you go. And among other things, as you said, a lot of administrative burdens, all sorts of other things related to that. Again, those developed, comparable, wealthy countries like ourselves, they're usually at around, their average is about 14%. Some are at 25 and 30%. That's how they get better outcomes at a less cost. So again, it's not about more money into the healthcare system, it's about reworking that system.
It's a lot easier to put a fence at the top of a cliff than an ambulance at the bottom.
Absolutely. Absolutely. So reworking our system to invest in primary care, number one. And there are lots of ways to do that. And I don't think it's necessarily going to take an act of Congress. You can actually do some of this just with tax policy. There are a lot of states, so this is not a new idea. There are a lot of states that are looking at this primary care spend and mandating in their states. These are red and blue states alike that are pushing primary care spend in order to do that, because they know what the stakes are, right? Number one. Number two, even though the government is working on negotiating drug prices across, Medicare and Medicaid, it's just not fast enough. We need to accelerate that. The amount of money that we're spending needlessly on expensive medications. The medications are important, but that profit level is
enormous.
It is. And it's time to really accelerate that. We know that it works. There were 10 drugs in 2025. There's 15 in 2027, and then another 15 in 20. You know this. There are thousands of medications that we can prescribe.
And we keep cranking out more.
We need to accelerate that.
Yeah, absolutely.
And then for us, a couple more. Then for us, we know that there's an incredible administrative burden in providing healthcare.
That was the next thing I was going to bring up.
We're getting away from providing healthcare to actually provide healthcare. More, it's about all of this administrative burden. And so there are ways to actually, stop that, improve that, regulate these things in order to make sure that they're on board with us actually improving outcomes, lowering our costs, et cetera. And then the last thing that I would say that I think is a real necessity and possibility is a public option for people to buy into if they want.
Yeah.
It doesn't destroy the system. You know, our healthcare now is about close to 20% of our GDP. It's a big part of our economy.
That's huge.
We can't blow it up.
Right.
But we can make some thoughtful changes to that in order to move things forward. And one of those would be, for example, a public option.
Like a Medicare for all type thing.
But selectively and move forwards towards that goal.
Okay.
You know, one of the things as the past CEO of Blue Ridge Health, the calendar event on my schedule, the worst one every year, was always sitting down with our insurance brokers to tell us how much our insurance costs were going up next year.
Yeah.
People were great. Don't get me wrong. If they're listening to this, they're fantastic. But it was always double digits, 12, 18, 22%.
Yes.
We're like, what?
Yeah.
Right? And then Medicare, it's going to be a 3% increase this year. We got to figure it out. I'll take that. Why don't we let, for example, nonprofits to start out. You can keep your health insurance that you have with these private insurance companies if you want, or we're going to offer you to buy in. I'm not saying it's free, right?
Right.
I'll send you literally the millions of dollars that our organization was spending on covering our employees with really good health insurance. I'll send it to the federal government and let them be on Medicare. It's a step forward to try and break this cycle that we're in right now.
And so that could potentially, obviously cut the profit motive tremendously, and you wouldn't have these, multi-gazillion dollar CEO pays. You'd also then, hopefully, with a single large payer, it would be more efficient, more standardized. Is that kind of what you're looking at as far as the actual where the rubber meets the road for savings for that transition?
Well, again, yes, but really the focus on savings is really driving primary care. That's where you're going to see these savings, and you're going to then be able to use some of those savings to either reduce our national debt or federal budget, but also reinvest in the healthcare system, strengthen that Medicaid and Medicare. But absolutely.
So I've come up with this kind of simplistic cockamamie scheme of completely removing the payer system entirely. No administration, no one but a medical provider and a patient deciding if an intervention is worth paying for. And then using instead regular market economics of someone deciding, is this worth paying for? Now, the obvious glitch with that is if you can't afford something, you die. So the solution to that, in my opinion, is someone like me who has good income, reasonably good health, would pay regular cash pay for whatever I need, up to something catastrophic. Someone who makes, the WNC average of, $63,000 per household, they would pay more like, a quarter to a third of the actual cost of healthcare. That way you wouldn't have this 40% of your healthcare dollar going down the drain to the administrative side. You wouldn't have medical providers such as ourselves spending hours going through prior auths, charting for the insurance companies. You'd instead have a direct eye-to-eye conversation with your patient and saying, hey, this drug's expensive. Is it worth it? There's this cheaper drug that has these side effects. It doesn't work quite as well, but it costs $3 a month, and this expensive one costs $180 a month. Your sliding scale at your income is going to turn that into $1 a month and $60 a month. Which one do you want?
So, Chris, you're really describing community health centers.
Okay.
That's what we do. People come to us, and if they don't have insurance, they prove they don't have income, they don't have money, we will see them for $0.
That's awesome.
If they have the ability, and we ask everyone to contribute.
Yeah.
But if they can't, we still see them. And
come on, man, that makes too much sense. Kindness and covering people. Are we going to really do that here in America?
This is what it's about. Every person, regardless of income, deserves access to affordable health care. It's as simple as that.
Yeah.
That is a social obligation that, as a nation, the wealthiest nation on earth, spending more money than any other health nation.
How are we spending more money and still having people die from lack of basic care? It's baffling.
Because it's a matter of reorganizing our priorities.
Yeah. And so with that, let's segue into some of the inertia that prevents these good ideas from coming to fruition. You look at the power of the insurance lobby, the drug lobby, even the medical lobby that keeps this money flowing through the system, and you look at how much that lobby bends politics, and you look with that at the power of money in politics. So my thought is we're not fixing these problems until we get the money under control. So what do you think with that, to kind of segue into American power, democracy itself, the control of money versus the control of voters? Do you have some specific policies, specific ideas, talking points that you think can bend us in a better direction there?
So one of my favorite sayings is change happens at the speed of trust, right? We have to build relationships within government again, right? They shut down the government, they go home, they're not talking to each other.
Right.
How are we going to solve problems if we're not sitting at the table, at least trying to figure out where our common ground is? And how do we use that as our jumping off point to say, we all agree, for example, primary care is a great option. Okay,
right.
How do we get there?
How do we do it?
Here are the instances to do that. When I say something like the public option, I'm not saying get rid of private insurance, but let's actually have another competitor in the market. What Republican or Democrat or capitalist is going to argue with more true competition in the marketplace, right?
No, they'll argue.
But the competition that I see, again, as an administrator in a healthcare system, between United Healthcare, Blue Cross Blue Shield, Aetna, whatever, they're birds of a feather flock together.
Right.
There's no real competition. It's what you said earlier. Loads of paperwork, prior authorization, denial, make you 2 or 3 times to actually get paid for your service.
Yes.
Right.
It's terrible.
So let's provide some competition for them, right?
Yeah.
And we've seen a change in how people feel about the government getting involved in private business. And so we have a golden opportunity to use it not to line the pockets of wealthy people already, but to help those individuals that we're leaving behind, right? That are feeling left out. And by doing that, let's negotiate drug prices. Let's get reasonable prices so people can afford their medications, their life-saving medications.
Yeah, for sure.
It's time.
It seems simple. It's well worth doing, and there's a lot of inertia against government intervention, against higher taxes on wealthy people, but I think that you're right, that the momentum is shifting, that after ACA eventually became so popular, people are no longer opposed to the idea of the government getting involved in healthcare and making it cheaper. And with that, let's segue into finance in general. And you look at the current tax codes where we've got these tax brackets that officially tax people in higher incomes, but you look at the people in the really high incomes, they've got these loopholes that let them dodge a lot of those taxes. I've used some of them even on the scale that I've done with my investing and my working. In 2019, I paid a federal tax rate of 8%. And there are people who make a lot more than I did in 2019 who are paying a lot less. So to me, if we fix that, then we've got money to put some government money into healthcare, whether it be a sliding scale, whether it be a central payer. We've got a way to help people who can't afford healthcare be able to afford it. So what's your thought on tax, finance, tax brackets, tax loopholes, how we get the economy back to where it's working for the middle class again?
Boom. There's a lot there. Let's unpack it a little bit at a time. So first, I want to just push back because I want to make sure people understand. You said we can take more money and put it into healthcare. We don't need more money in healthcare. Matter of fact, if we move from our price per person that we spend in healthcare in the United States and move down to the level at where Switzerland is, right? Yeah. They're still spending more than the average, but it's like $3,000 less per individual than we are. We will save $1 trillion. Yeah. Right?
And we can do that.
We can do this, right? So it is, when we look at this national debt, and I feel this tremendous obligation. I look at my kids and I look at my friends' kids and their grandkids. We are shouldering them with a national debt that's going to shortchange their future. We need to make that change happen. Remember, though, it took us 45 years to get into this mess. We're not going to get out of it in a year or two, right? We need to take the long-term approach to how we're going to solve our economic issues. One is Let's be smarter with the money that we're spending. I'll say another, you're talking about the tax policy. When I was doing some research about it, some of the first people that they fired in the IRS were the auditors.
Mm-hmm. Right.
And to me, that's analogous to saying you need to cut dollars out of your healthcare system, fire your billers.
Right. Yeah, exactly.
That makes no sense to me. The number that I saw was astonishing, right? The amount of money that we spend to actually hire and have IRS auditors is really small compared to the dollar amount that if people just paid the taxes that they owe within the system that we have now. No tax policy change.
Right.
It's nearly $1 trillion again. It's like $700 or $800
There's that much that's getting underpaid.
$1 billion. So spend a little, get more back.
Right.
And I think everyone, even if you didn't change anything with the tax policy, I don't think you could find very few people that would say, well, if it's the law and the policy now, people should pay it.
Right.
They should pay their fair share like everyone else is doing.
Other people should pay it, but I shouldn't pay it. This is what I hear. And this is what's going on now. With the current administration,
and we can fix that.
they're kicking down these auditors for a reason. It's not to save money. It's to let their buddies not pay as much taxes.
But I think, again, people look at this and say, this is common sense. This is really a moral imperative, right?
Yeah, absolutely. I mean, I feel like there are people who are trying their best and doing what they can with what they've got, with the education and background that they have, and are still making, $30,000, $40,000, $50,000 a year and paying taxes on that money. And there's people like us, you don't want to lump us together, but I imagine you also make pretty good money and you're pretty comfortable. And there's all these loopholes. We can dodge taxes if we want to. We can keep most of that money. And I think there is a kind of a conservative morality that says we've earned this and we should keep it. And we should not have to support somebody who hasn't earned as much. And we should blame the poor for their poverty and not fix it. And, I wonder if you have any thoughts on how to overcome that thought, how to get people to really care about the whole and to be willing to have some of the wealthy people paying more taxes. And you're right that with healthcare, there's more than plenty of money in the system. We can spend that money wisely, spend less of it, and have better healthcare. I mean, the example of Medicare for All, I think, would save us about $650 billion a year and something like 68,000 lives. Just that one change, just that relatively simple change. But to go to kind of the larger tax and spend and economy, just to get more of your thoughts on what is socialism, what is fairness, what is the right way to tax and spend, what is the right position for government?
I'm going to answer your question with a little bit.
It's kind of a lot there.
Yeah, it is a little bit of a tax. So I think we need to do in general a better job of messaging around what, for example, what Medicaid really is. I hear a lot about it's a handout. In my work, it has been a hand up. And I'm going to tell you a story about a patient.
Yeah.
Severe childhood trauma, left home very early. Soon as he left home, this is a patient out in Western North Carolina. Soon as he left home, homeless, unemployed, no healthcare coverage, right? Had severe trauma, lots of mental health, related issues to that. Came into our health center. We ended up getting him, these supportive services, these wraparound services that people may say, oh, that's just, why are you wasting your money on that? First thing, got him a home, place to live. Second thing, we got him transportation, a bicycle, so he could get to work.
Yeah.
We gave him the support, the mental health support, in order for him to learn how to trust people, how to communicate, and also worked with his employer to help make sure that that relationship went well when he was at work. Now he's up for a potential promotion to a supervisory position. He got Medicaid through Medicaid expansion, and he's about ready to get off Medicaid expansion because he'll now have employer sponsored. That's
where it's at.
That's a hand up not
Yes.
a handout.
Yes.
And to me, these are the stories we need to tell folks.
Yeah, absolutely.
And we see them all the time. And people in Western North Carolina are going to be hurt by this, and they understand that now.
Yeah.
I go back to my basic premise, and I hope,
Right.
sorry to sound like a broken record,
It's a good premise.
everyone deserves affordable taxes.
Yeah, absolutely. And I like what you're saying, that you're not just giving somebody money or like giving them my hard-earned tax money. You're bringing them from a place of being outside of society to being inside of society, a place from not being productive, not being healthy, to being healthy, being productive, paying taxes, paying back into the system.
And I go back to my original story. It's about dignity.
Right.
Dignity is important for everyone. We should have a social obligation to make sure we protect people's rights and preserve people's dignity.
Yeah, absolutely.
That's not hard to do.
Right.
We have had a very generous, charitable nation throughout our history. Look at the Statue of Liberty.
Right.
Why can't we get back to that? Right?
Yeah, absolutely. What about, let's segue into a somewhat related topic, education. This is something that I feel personally very strongly about. My wife is very active in education, working with Public School Strong. We helped elect Lindsay Prather and break the Republican supermajority to keep our funding of our education. And it's something I feel very passionate about. And I believe you probably are of a single mind, the way you speak about dignity, giving people a chance, letting them get in. What do you think we need to do with our education system compared to what we're doing now, especially here in North Carolina?
So first, again, I'm going to talk a little bit about social obligation. I think there's a generational obligation, and education is one of those things. We have an obligation from generation to generation to provide the best possible education system for our kids and those folks that come behind us. I think our government is failing that miserably. We must, and we will, do better. My wife is a school teacher.
Oh, right on.
Retired now. Second grade school teacher. Education is really an investment in our future. And when we underinvest, whether it's in teacher salary or whether it's in our ability to get the resources that we need for the kids or to provide them with the best possible opportunities for their education, that's a recipe for disaster. When you underinvest in our most valuable resource, those are the people that will, come after us. That's a mistake, and we need to do better. With that said, Chris, there are federal responsibilities and there are state responsibilities.
Mm-hmm.
So as running for Congress, I'm focused on what are those federal responsibilities. Right. And some of that is to hold the states accountable to actually creating a better education system. And we can continue to do that. I think one of our potential flaws is, for example, I'll go way back to the No Child Left Behind, right?
Yeah.
It was an attempt. Hey, let's try and hold states accountable.
Yeah.
Was it perfect? No. Was it a possible step forward? Yes. But then after a few years, it's like, well, this isn't working. Well, why throw the baby out with the bathwater?
Yeah.
As opposed to saying, why don't we try and take the things that were good,
right,
learn from the things that failed, and make a better accountability system for the states.
Yeah, absolutely. So we've been talking about access, getting a better life, our responsibility as humans, as Americans, and with that we segued into education. And as I was saying before, I'm a huge proponent of education. I believe investing in our future is one of the best things we can do. I think it helps not only those who get the direct education, but it helps business owners, it helps the economy in general, and it's just the right thing to do. And if you're born into a poor family in a bad neighborhood, you don't deserve to have a bad life as a result. You at least deserve to have the opportunity to pull yourself up by your bootstraps and make something of yourself. And in my opinion, education is the way that we do that.
100% agreement. So there is really a generational obligation in order for us to provide the best possible education for each of our kids. That's an investment in our future of this country, an investment in our most precious resource. And we are failing that obligation as a nation today, and even as a state today as well. I recognize that the education in this country is really two-pronged. There's federal work and there's state work. And a lot of the education pieces that we talk about are really run by the states. Mm-hmm. But I do think that there's a role in the federal government to actually provide oversight and incentive to make sure that the states are held accountable for the dollars that they have in the education of our children from a national perspective.
Yeah, absolutely. Because we are a single nation. And if you're born in Mississippi, you have just as much right to prosperity as someone who's born in New York or California.
Absolutely.
It shouldn't depend on what state you're in. I agree. We should have some standards and even some federal help. I think that as the states vary more in how they deal with education, especially North Carolina, what are we, 47th, 48th now in education? We're way down the bottom of the bucket. I think you're right, that there is some responsibility of the federal government to hold us up to some standards and make sure that we are educating all of our people and not just in certain areas.
Right. And my wife is a teacher. She's retired now. And, I saw how hard our teachers work, how invested they are in the success of their kids, in the success of their families. And it is really a miracle in terms of the heart that these folks have. I would challenge any legislator, Chuck Edwards or anyone in the state legislature, to go and be a teacher for a week.
Absolutely.
And understand what it means to do the work that they do for our kids and our families.
Yeah. My wife's done an incredible amount of work with Public School Strong,
Great.
A lot of direct work with the PTA, with our local schools, and I will strongly argue with anyone who says that we're not using money efficiently there. They are running on a shoestring budget, running an incredibly efficient operation, and it's that heart you speak of that makes it happen. It's that dedication that makes that happen.
Absolutely.
So to me, education is money well spent, and we can't go wrong by putting more money into education, reducing classroom sizes, improving access to resources, technology, improving teacher pay, making teaching more competitive, making it where we have the best teachers that we can possibly get, because this is our future. Right. This is what we're doing. Other aspects of our future that I'm concerned with right now are the structure and fabric of our democracy, free speech, fair voting, the power of money in politics versus individuals. Do you want to dive down that rabbit hole and talk about that and some of your ideas for stemming some of the tide, putting the guardrails back up, getting our democracy back on track as a congressman?
I'll say one thing to that, right? Our founders of this nation developed a 3-branch government. Right now, it really seems we have one branch controlling the 3 branches. Mm-hmm. What I believe is necessary is for us to get Congress, and in particular, the House of Representatives. That's why I'm running for Congress, to get the House of Representatives to actually live up to their constitutional authority and obligation. We need to get our government working again as it was designed by the founders. It's as simple as that. And we need to do that and start that with a change in Western North Carolina. Mm-hmm. And let's get rid of Chuck Edwards, who is not doing anything.
He's not doing anything
except giving more of Congress's authority and power to the executive branch.
Absolutely.
That needs to stop.
That needs to stop.
And I think a lot of things will come from that action alone, right?
Yeah.
The power of the purse again. Yeah. We look at this incredible SNAP funding. It's like, we authorize SNAP funding, you're going to do it, or we're going to get it out, right? It's as simple as that.
Right.
That's what the House of Representatives, the most representative body in this government, said they want to do.
Yeah.
So,
absolutely. What about free speech, political vitriol, political violence? Is that something you want to comment on?
So as a physician, I'm, violence of any kind is just an abhorrence to me. I do believe that we have an epidemic of violence in our country now that is not being addressed. And we need to perhaps save some of those $1 trillion that we can save in our healthcare system to actually invest in more of the mental health aspect, if you will, of sort of this culture of violence, this epidemic of violence that we have. And again, those things, because to me it's primary care again, those things will pay dividends down the road. Yeah. We'll have fewer people in jail. We'll have more productive members of society. Think about the story I told you about the gentleman out in Western North Carolina. If he hadn't had the help, Right. What's going to happen?
He could, yeah.
Probably
he could end up with violence, jail.
I'm hungry. I don't trust
Absolutely.
people. I haven't learned how to interact. We invest in that, and we're going to slow that spend down, but make people with more dignity and more productive members of our society.
Yeah, absolutely. Give people the ability to be safer and happier, and we would reduce our violence. Do you want to speak any to the political side of it, though? I just feel like the vitriol that we have, the finger pointing, the hating on Republicans, the hating on Democrats, it's spun so far out of control. And I don't know what Congress can do about it, but is there anything that you would say or do, even just say, coming in to try to get us working together as a nation and get us back on a track of cooperation?
I go back to something I referred to earlier. We got to talk to each other.
Yeah.
And if Congress isn't talking to each other, then they are modeling the behavior that they expect from us.
That's true.
And what I would say is we need to lead as a people, and they will follow us. We need to have conversations with our neighbors. We need to have these. There's a favorite saying of a poet of mine. It says, between right and wrong, there's a field. I'll meet you there.
Mm-hmm.
That's what we need to do more of.
Yeah.
We need to sit down with members who may not agree with us on everything,
right,
but may agree with us on some things. Find that common ground, build the trust, get the change happening.
Yeah.
That's what I've been doing my whole life as a physician, as well as running a healthcare system in Western North Carolina. And I want to bring that model to Congress.
Yeah, absolutely. I'd love to see that. Let's talk about a couple other issues where Democrats have frankly been getting our asses kicked lately. And this was one of the biggest reasons that I entered the race earlier, was to try to get us to own up, talk about some of these issues before they festered and got even worse. I feel like the big one is immigration. It shouldn't be, in my opinion. I think the actual policies of Democrats and Republicans aren't that far apart, but the voices on each side are. The extremes on both sides are. What do you think about immigration? Specifically, what is a fair and good immigration policy? And how do we stop losing elections because of this issue of immigration?
So I think as you're describing the Democratic Party as a failure as a whole, I think we're seeing a break in sort of the Republican Party as well, right?
Mm-hmm.
And again, we need to lead as the citizens, and our leaders will follow. I know that bumper sticker that you see all the time, but it's true. We need to let them know we are not satisfied with the way they are solving problems at this moment in time. Immigration, in general, what I would say is, for me, immigration has provided us economic and cultural and values that have been important to the development of this nation. I don't see that changing. With that said, the last time we had any immigration change was over 45 years ago.
Wow.
Legislation, 1986. You know what we had? We had a Republican president, a Republican Senate, and a Democratic House. They came together, they talked, they got legislation. Our immigration,
and that's likely what we'll have in 2 years.
Since 1986, right, has changed dramatically from what immigration was like back in 1986. The numbers, how many people we have, who's coming,
where they're coming from.
All of those things are.
Yeah.
We need to just sit down and talk about it. And again, where's our common ground? Find that common ground. Let's get some legislation passed on that. What's the next common ground can we find, and build upon that? I think also, as I've said throughout this podcast, Chris, is again, it's about dignity. It's about moral obligations, whether it's to the next generation or just human beings in particular. And we can have a moral and sane and common sense immigration policy without denigrating people, removing their dignity, but also protecting what we need to protect as a nation in this country, whether it's our borders, whether it's jobs, etc. We can do that. We can have all of this. We don't need to be doing it the way we're doing it, though.
Yeah, I firmly agree. I think there are problems to solve. Open immigration is not the answer. A porous border, in my opinion, is not the answer. But terrorizing people and denigrating them and looking down on them because they're from somewhere else and they want a better life, that's not going to work either. It's just, as a human, I dislike that. But it is a tough issue. It's one that the Democrats are getting our asses kicked on, and I think that a lot of us have not spoken clearly enough on that. I like what you just said there, and I'd like to see more Democrats saying that, yes, there are problems with immigration. There is a need for immigration policy. There is a need to do this right, where I think we've been pushed by the extremes of the right to become more extreme on the left. And I think your ideas of sitting down and talking and finding that middle ground are going to be productive for immigration and for other issues. The couple of others that I see a lot. I talk to a lot of Republicans, a lot of Trump fans.
As do I. Well, I talk to a lot of Republicans who also
do as well.
left the Republican Party.
Right, exactly.
And they're coming on supporting my campaign.
Exactly. And some of the big objections they have, other than immigration, are crime control and government efficiency. Crime control is something I get a lot of pushback from Democrats. They say, oh, we're doing a great job. There's worse crime in Republican cities. That's due to other factors. It's not due to enforcement. That's due to more guns and less education. If you really look at the actual enforcement, Democratic cities in general are looser on crime enforcement. Property crimes are higher. They tend to go unpunished. And this is something that really pisses people off. And this is one of the many things that caused us to lose so badly in 2020, is that people are sick of having their stuff stolen and getting mugged. And a lot of the Democratic judges are, in my opinion, more concerned with the rights of the perpetrators than the rights of the victims. Is that something you're willing to speak on? Because that is something that you'll be doing some work on, in Congress. You'll be doing some work on crime control.
So in general, I'm a fan of due process, right? For victims as well as for the folks that are being accused of crimes. Mm-hmm. And so we need to get back to what is a due process? What is our societal expectation and our legal expectations around what due process are? I think, sometimes I think it's okay. The other side may have some points to make, right? Mm-hmm. Grew up in Chicago.
Yeah.
Certainly lived in a big city environment where crime was different than it is out here in Western North Carolina, right? So, but the issue is, maybe they have a point, probably do have a point, but their answers are totally wrong, right? Mm-hmm. Let's send the U.S. military, let's send the National Guard. If you feel the cities need more police support, then actually help them fund more police.
Support the police.
Who live in the community, who are going to actually make the necessary changes to actually make these things better.
Right.
As opposed to, let's make a big to-do out of it, let's go in, say we solved the problem, leave, and then all we've done is just
shaking things up.
Exactly.
Haven't solved anything. Yeah. Exactly. And you may end up with a similar answer on government efficiency, where I believe there is an issue with government efficiency. There are agencies that are spending too much money. The times I've been inside of parts of the government, I've seen it. And I know friends who work in certain aspects of the government where money is going down the drain at a pretty high rate. However, you look at DOJ, they got a bunch of thugs with chainsaws and baseball bats just breaking shit at random. That's not making the government more efficient.
So my take on this is that efficiency is one thing, but effectiveness is actually more powerful, right? And so when we look at how the government is run, and as a community health center, I have a government agency overlooking the work that we do and the work that the 1,400 to 1,500 community health centers across the United States do. Great people. Are they perfect? That is, the system around them, do they have the right tools to actually make sure that we're most effective rather than worrying only about efficiency? And I don't believe they do. And so that is Congress's, and to some extent the executive branch's, responsibility to say, what did we want when we appropriated this money for this reason? What were our measures? What were our expectations? And how are we following to make sure those expectations have been met?
Right.
If our expectations change over time, then how do we create a better government then to make it more effective? Efficiency is, again, I fire all my billers. That's really efficient. I've saved money, but it's terribly ineffective.
Exactly.
It does nothing to help my organization survive.
Right.
And so we need a different thought process about it's not just efficiency, but it's also effectiveness as well.
Yeah, absolutely. No, I like that. Let me see what else I got on my notes. Stuff I was gonna ask you about here. Yeah, no, I've gotten through all my list of stuff I wanted to ask you about. Anything you want to visit? Any subjects that you just want to speak on, discuss? I'm wide open.
I think we've covered a lot of ground here today, Chris.
Yeah, we've covered some good stuff for sure.
So I'm super hopeful. I had one thing as we talk about this, and to sum this up.
Yeah.
This current administration has been amazing at destroying things, whether it's the East Wing of the White House or our government or whatever programs
our
that
trust.
We're doing, SNAP benefits, all of those things. They don't have a plan. I'm not even sure they have a concept of a plan to how to actually build things again or better.
Mm-hmm.
This is our golden opportunity. These things have been destroyed.
Okay.
Let's get folks that want to get to Congress that actually can dream big about how we can rebuild a more effective, a more humane, a more moral, and a more caring federal government again. That's why I'm running for Congress.
Yeah. Rock on. That sounds great. Thank you.
All right. Thank you,
appreciate
Chris.
you doing it.
I appreciate you having me.
Yeah,
Such a lovely
absolutely.
afternoon on your back porch.
Yeah. Thanks for coming over.
Thank you, Chris.